Awesome. So when we're looking at phosphatidylcholine, phosphatidylиnositol, phosphatidylserine, all of these are just fancy words for the fat that cells are made of. And if we don't have the right ratio of these fats, the body can't remodel cells, which is just how do you fix an injured part? Or if the cell is beyond repair, say, okay, it's time for you to leave now and use those parts to make new cells. So when we're coming at any sort of pain point, whether it's dementia, whether it's chronic pain, whether it's leaky gut, IBS, Crohn's, we have to make sure that these short chain fatty acids are being absorbed and utilized by the body. So the there's an oral protocol which works and would be sustainable long term, but the IVs are what kickstart it all. The IVs are the more expensive part. So that's where if we each IV is about $1,300, 1,300, I think it's 75, 1,375 per IV. Because this is imported from Switzerland. It is the highest quality short chain fatty acid you'll get. And those IVs, if you're like, I want to do them, but we can't do them regularly, that's something where, in conjunction with the oral therapy, would just enhance how quickly he's recovering. So, what happens in there are tests. If you wanted to do the test, I could specifically show you the biomarkers, but the test alone is $500. So, the test breaks down and shows me the ratios of is he demyelinating or is he rebuilding? And they're two separate numbers. So if he's rebuilding, but it's really, really low, but he's demyelinating really, really quickly, I can see that ratio. Demyelinating, meaning how quickly is the brain breaking down, versus the remyelinating is how quickly is it rebuilding. So that's where we've really turned to phosphatidylcholine to be the kind of cincher. I don't want to call it the Hail Mary pass, but it works for all sorts of conditions because we're not dealing with gut integrity. Is he absorbing this? Did he swallow all of it? If you put something in a smoothie, did he drink it all? You're not dealing with any of that. Plus, you have the gut integrity and absorption. We know I'm losing about 30% of whatever I put in the mouth. So if I give you a gram, you're really only absorbing 70 milligrams. So the IV takes away all those issues, but it also allows for faster utilization. When we do IVs, there's another component, and this would be a part of the oral protocol as well, but the pills are really stinky. It's called sodium phenyl butyrate. This is a salt byproduct that is made from the gut bacteria. So in a healthy person, the gut bacteria makes sodium phenyl butyrate, and sodium phenyl butyrate helps the brain to say, this is an old cell, break it down. So that acts as a messenger or like a scout to say, where are the weak areas? Which just means when you pair it with the phosphatidylcholine, you can kind of clean out the bad and rebuild the good, one right after the other. So it's intense for the really aggressive patients. And it's like, we need to turn this around now. We say every day for 3 weeks minimum, Monday through Friday. We ask them to get a PICC line. So a PICC line is when they do a deeper IV. That way I'm not stabbing the person over and over again. It stays indwelling in the arm, and it can stay there up to 90 days. But that placement alone is $700. This protocol adds up quickly. And I don't want to sugarcoat it. If this is something you want him on, I need to give you the raw dollars. And I'm sure if you say you want to do every day for 3 weeks, I can talk to Dr. Jen and get you a discount. But I want you to know the base amount So if you're talking about some kind of GoFundMe or whatever you're planning on doing, then you know the baseline we would need. So PIC insertion would be 700. Each IV 1375 times 15. And then the oral protocol is separate. So then we would have to add up how much is the phosphatidylcholine, how much is this, the sodium phenylbutyrate. It's not bad. You don't go through much of that. And that's essentially, we would be pumping his body full of those short chain fatty acids so he could rebuild the cells.